erythrophimosis, and how all the efforts were scarred. So we have a 15-year-old female with ptosis and epicanthus inversus syndrome, and a previous history of surgery at around 5 years of age elsewhere. And we can see that she's around 7.5 diopters of myopia, and we can see that there's an earlier scar there, a little bit of hypertrophy, but this surgery has taken place at 5 years of age. And after that, most probably the patient got a little dissatisfied with the results or had not been properly counseled. So we did a detailed counseling and planned a YV-plasty, a medial canthoplasty with or without shortening or plication of the MPL, followed by a ptosis surgery. We talked to the parents, but the parents seemed to be reluctant because they didn't want multiple surgeries. And finally, the patient did not turn up. We saw the patient again 8 years later, and she was 23 years of age. This is 2007. And patients now were desperate about treatment, and patient was very, very enthusiastic. And myopia was stable at around 11 diopters. She was using contact lenses. And she had literally finished her studies. Now she was into another stage where they were desperately looking for treatment. So they refused treatment under general anesthesia. So they were explained that there are going to be multiple surgeries here. So we did a VY-plasty, a medial canthoplasty on both sides in 2 sittings. But as soon as we saw that, we finished that part in March, we could see that there was some amount of hypertrophy of the scar, because a big plasty was done there, medial canthoplasty was done there. And we started massaging the scar, and the scar started going down. In May, we did a super maximum LPS resection in the right eye, and you could see the scar in the on the left side has gone worse. The massage was continued. And in June, we did a maximum LPS resection in the left eye. And I would want to point out here that this patient found out a very innovative way of keeping the inverse frost suture. She pulls the pin up rather than tape it on the forehead. She ties this inverse frost suture on the because she got a lot of experience by now. So in June, we seem to be having a reasonably good ptosis correction, and the scar is better on the right side, but it's worse on the left side. And the patient is suddenly getting very dissatisfied with the results. There's still some persistent edema on the left upper lid, and the lid crease is not exactly perfect. But this is not what is giving us the trouble. The trouble is the hypertrophy of the scar. So because we are in the process of fixing things, most probably we let this scar get unattended because there were bigger things happening. So the massaging continued. And after that, we realized in July that we cannot go let this go. And we did an intralesional steroid injection. 20 milligrams were injected directly into the fibrinous portion of the scar, repeated twice, 3 weekly. Patient was very irritated by this time by the number of follow-ups, also related to her refusing surgery under general anesthesia, where we would have cut down the surgery to 2 sittings. Anyway, a patient was definitely getting better, but there was a persistent scar. So you can see the lid edema on the left side is now less, the lid crease is better, there's a hypertrophy of the scar is also less, but because all oculoplastic surgery is basically, especially on the, is cosmetic, so patient is still very dissatisfied considering the age at which we are handling this case. So we went ahead and corrected her 11 diopters of myopia, hoping for the LASIK wow effect, and that definitely happened. But in small cities where people are very closely connected, there's one day 2 parents coming, another day 1 parent, another day the uncle, auntie, everybody is turning up and telling us, doctor, everything is fine. The post-LASIK correction is fine. So I go ahead and give an intralesional steroid again. And you can see that there's some amount of atrophy and there's a fatty layer developing there. So patient understands that she's getting better, but there's a but attached to it, and all the relatives, for two reasons. One is the amount of money they pay for repeated surgeries, the LASIK, and the number of visits they had to do and the follow-up. And at the end of it, she definitely thanked me, but there was a lot of stress in those 9 months area, and that 9-month effort, which seemed to be reasonably good, but for the scar, was quite a strenuous one. So what we're talking about is the possibility of a small scar or hypertrophic scar, because it's on the face, giving a bad taste to a otherwise good effort. So could it be avoided? And what sutures are generally good for this, to avoid it? What are the management options and what I should have done differently? And the counseling part. I'm sure I counseled the patient very well, but even then, there are many problems which are associated with a case like this. Thank you very much for your kind attention.